Hi there. We are on chapter 9 now. So for this next exam, you only have 2 chapters. So we talked about the nursing process. The important things to know from that are the QSIN, which is that one slide, as well as your nursing process. Now we're going to talk about safety and quality. So safety and quality, let me get this thing started, includes your 5 rights to medication administration. And let's get started. Okay, so first we're going to talk about this. Now another is a foundation for medications and learning about pharmacology. So 5 plus 5 rights of medication. So this is very important for you to know. We need to know the right patient, the right drug, right dose, right time, and right route. So anytime you're giving a medication, you need to look at their armband. You need to match the drug to what's ordered on the med sheet, on the med thing and the computer. You need to make sure it's the right dose. You make sure that you're giving it at the right time and you're giving it the right route. There's 5 additional rights that have been added over the last couple years, I believe. You have to make sure you do the right assessment, you document it right, the patient's right to education, the right evaluation, are they tolerating it okay, are they having side effects, and the patient has a right to refuse. So 5 plus 5 rights of medication administration. So now we're going to go over each one in a little more detail. The right patient. So 2 forms of identification are required. You can ask them their birth date, and then you can look at their armband. But there's 2 forms of identification. The right drug. Order must be by a licensed healthcare provider. You must read the label 3 times to make sure, because there's a lot of medications that sound alike, read alike, that look alike. Be familiar with the patient. Allergies are the most important thing that you need to know about the patient. Allergies. So remember that, when you're seeing anybody, before you give any medication, do you have allergies? Any lab results and vital signs. But allergies are the most important, so remember that. And then why is the patient getting the medication? Make sure you check the dosage calculation. And it could be just a straightforward oral medication, but if not, you really need to recheck the dosage calculation. And the right time, what's the policy? So for example, if med is due at 9 o'clock, some places give you an hour before to an hour after. Some other places give a half hour before and half hour after. So if it's due at 9, 8:30 to 9:30. Use of military time reduces errors. So if you don't know military time, you will be getting to know it, especially if you work PMs. PMs and day shift. All right route. We need to make sure, because we talked about absorption on the last test. So is it going to be absorbed correctly? So make sure it's ordered that way, or it's supposed to be given that way. Can they swallow the medicine? There's many medications that you can't crush, like potassium pills. You can't crush them. You can dissolve them, but if you crush them, it breaks up the medication. So you have to make sure that's okay. Are they scheduled for anything like dialysis? You can give them a medication before, and it's just they're going to go to dialysis and it'll flush right through their system, so it won't work. So you have to make sure there's certain drugs they can't take. And make sure that they're getting them at even intervals throughout the day. So if it's twice a day, it's 9 and 9. If it's 3 times a day, it's 9, 2, and 9. If it's 4 times a day, it's 9, 1, 5, and 9. So it's just to divide it up. You don't have to memorize the times. Just understand that they need to be at regular intervals. And then give them water. The only thing with juice is a lot of medications may interact with it. Not necessarily interact, but maybe their absorption won't be as good. So iron can be taken with orange juice, but just keep it at water. And make sure that you have allergies or health history, get to know them. Write documentation. Record it immediately and make sure you document the response to the medication. So you're going to give it, come back a little later, how you doing, and make sure that they're okay. And then make sure you tell them what you're giving them and why you're giving them, and ask them if they have any questions about it. Especially if they're going home, you're going to go over a lot of side effects and things to call the doctor for. we want to make sure that again, this is going back to education, and now you're going to say, okay, is this medication working, and are they having any side effects? Also, they can refuse. So if they refuse, then you need to make sure that you document it. You've explained it. You're going to document risks were explained to patient as to why regarding taking this medication, and then make sure you tell them what the benefits are of taking the drug. And follow-up is required. And then nurses' rights. A right to complete and clear order, right to correct. This is your rights as a nurse. You want a complete and clear order, which is why doctors really aren't allowed to handwrite anymore, and make sure it's the correct drug, route, and dose. You have a right to access information. You have a right to policies to make sure you're going to give it safely. And identifying any problems. You have the right to stop, think, and be vigilant when administering medicines. Now, this is one thing that's tough in the nursing world because it's so busy, you don't have a time to think. But you have that right to stop and think when you're giving those medications. So if you're overwhelmed and say you're not sure about the dosage, you have a right to stop and just process it in your head, maybe do another calculation. Nobody should rush you through that. All right, so let's talk about safety now. There's a culture of safety, which is emphasized. So the American Nurses Association encourages organization to avoid punitive approaches in drug error reporting. We don't want people to get in trouble because we want to learn about it. Otherwise, nurses will shy away from reporting specific drug incidences. So we should be encouraged to report errors so the system can be repaired and fixed. So the Joint Commission has taken steps to support this, and Joint Commission is who comes in and makes sure that everything's where it needs to be, and they have these patient safety goals. So they focus on healthcare safety goals. So as part of it, it started in 2004, which is difficult for me, that you're no longer able to use selected abbreviations, acronyms, and symbols because they can be misinterpreted or misread. So anytime you see something that says BID, QID, that's Latin. And I was taught Latin, so it's just a simple way to write things out, but we're not allowed to do that anymore. So you may see, when you go to the doctor, you may see that still written, but we're not really supposed to. So anytime you see that, you need to verify that with the physician who wrote that. All right, so there's something called drug reconciliation. We want to make sure that the drug all the patient's medication is accurate at all times. So at first you want to get an accurate list. And I know we talked about this in the last unit, that you're going to ask specifically everything: over-the-counter, herbal medications, and prescription medications. The patient should always carry a list of drug information in case of emergency. So a lot of doctors' offices will give out little cards that they can fill out. They should update it anytime there's a change, and they should bring a list of medicines to each doctor appointment. So that's minimum. I actually tell my patients to bring their medicines to the doctor. They just set them all out, and I just look at them one by one. Disposal of medications is another safety concern because people are putting them in the toilet and ending up, in lakes and things like that, which is dangerous for fish and as well as our drinking water. We just don't know what's not filtered through correctly. So we need to follow specific information. Transfer the drug from original container to an undesirable substance like kitty litter. All right, so you place the mixture in the container like a sealed bag. You take all the identifying information on the label before disposing of it. Don't flush them down the toilet unless instructed. And then you return drugs to a community drug take-back program. Usually you can call the pharmacy, pharmacies in town that probably know about, or they should know about, drug take-back programs in the area. So there's a lot more to medicine than just throwing away medicine, but I know in reality we all have thrown away pills before, correct? I know I have. It's just easier to throw it in the garbage, right? So this is the accurate way. So just make sure you know, because a lot of times patients will give you the bottle and say, here, you take it. And I'm like, no, you need to dispose of it in the correct way. If it's something that I can put in like a sharps container, I will go ahead and dump the pills in there and then take the label off and throw it away. And then speaking of sharps safety. So we do have a Needlestick Safety and Prevention Act of 2000. So with that, we use the sharps container. We have syringes that don't have the needles exposed, and you can lock it up right away. IV, start kits, that kind of stuff. So there's a lot of things that have been done with sharps safety. There's some safety risk for medication, which is tablet splitting, because some tablets aren't meant to be split. If it's a 40 milligram tablet, they don't have a score in it, that means it's not meant to be split. So you may not be getting all of the medication or too much of it. Also, buying meds over the internet. You have no idea where some of these drugs are coming from. So people say, oh, I'm ordering mine from Canada because it's cheaper. Of course, we're all thinking of the dollar. I get that, but you don't know what kind of company it is, what it's rated, and that kind of stuff. So, and there's a lot of counterfeit drugs. It may look like the drug, it may not have any active ingredients or wrong ingredients, it's not packaged correctly, so make sure you tell patients to only purchase them from licensed pharmacies. Also, always contact your pharmacist to make sure if you can crush the drug or not. So any extended release or sustained release, that means it's in your body and it's like breaking down over a period of the day, they should not be crushed. There's some high alert medications that can cause significant harm or death if given in error. Epinephrine, insulin, opium tincture, which is like a morphine derivative, nitroprusside, that's for your blood pressure, potassium chloride injection, that's very dangerous. It has to be given in a piggyback, an IV piggyback with about 500 cc's of saline. Heparin, you could bleed to death, and warfarin, which is a blood thinner. There's a lot of drugs that look alike and sound alike. Ephedrine and epinephrine, Amaryl and Rimonel, Captopril and Carvedilol, Depomedrol, Solumedrol. You don't have to memorize these, just understand that there's a lot of look-alike, sound-alike drugs. Other factors to prevent distraction-free environment. Boy, I wish that was reality when you're on the floor and it's very busy. So try to zone out, but you have that right to concentrate on it. And medication safety zone, a place that you can actually get your medications ready, wherever that may be. There's a bunch of resources here. You don't have to know this for the exam, but you do need to know this possibly for your NCLEX. But you need to know in general just for getting out and practice. Sorry, my dog is here trying to get a whole lot of attention from me. So make sure you have your drug reference book, pharmacist, and you can look through these. Oh my goodness, my doggy. Okay. So, guidelines for medication administration. Examples, you check the medications order, check for allergies. You prepare meds only one at a time, so don't line up all your patients' meds and go down the hall. Calculate the dose and do a double check of the calculation. So double checking. What's the expiration date? There's many medications like insulin that has expiration dates. Don't leave the medications just sitting out. Only the drugs that you've gotten ready you administer. Again, that goes back to not giving them to multiple people. Remember the 2 identifiers. Staying with them until they took all of their pills. Don't just leave. I know it's so hard because we're so busy and they can take so much time to take their pills. But you have to really stay there until they take it. And then you need to come back and make sure that they don't have any side effects. Or if it's pain medication, you have to write if they're having any relief from that. So practice question number 1 is the nurse is required to chart the patient's response to all the following groups except opioids, antiemetics, that's anti-nausea, sedatives, or all the above. So it's all the above. This is an easy practice question. The nurse reads the following order. Take 1 multivitamin QOD. The nurse will, are you going to administer it every morning? You're going to give it every other day? Call the prescriber to clarify the order, or refuse to administer the multivitamin and document it as not administered. So QOD means every other day. So I know that means that. So I'm going to take out A for sure. I'm really going to take out D because I can't, I mean, yes, you can, the patient's really not refusing it, so that wouldn't be correct and accurate. And you'd probably want to call the prescriber to clarify the order first, because first of all, it's not written correctly. Because remember, that's against the rules. You cannot write the abbreviated terms anymore. So I'm going to take out B because I'm not just going to assume that means every other day. You're going to call the prescriber to clarify the order. And that is it.